Hello, my pregnant friends. Today we're talking about sciatica or piriformis syndrome. Do you know how to distinguish between the two? Many folks that I talk to, or many of the clients that I encounter, have been told by their prenatal providers that they have sciatica and that it will go away after pregnancy. However, a lot of them come to me and they're like, I'm in pain and discomfort, and my provider has kind of told me that it will resolve as soon as I have the baby, and there's not a whole lot I can do about it. But I am here to tell you there is some things that you can do during your pregnancy to find relief, ease, and comfort if you are suffering from sciatica or piriformis syndrome. So you will see my most recent post on my Instagram page, Mama Shakti Prenatal. I go in detail kind of explaining about what is piriformis syndrome and what are the symptoms and how and who can assess those. So first we're going to talk a little bit about what piriformis syndrome is. So this is a pelvic model. This is the back, the sacrum is right here, right? You have glute muscles right here. You have piriformis muscle that runs like this, right here. Now you have a piriformis muscle that usually kind of wraps around the behind or the back side of your piriformis muscle. But on some folks, it can actually go through the piriformis muscle. So if you have any sort of inflammation, trauma, physical injury, old or new, if you have extreme body changes, hello pregnancy, postural changes, rapid weight gain, hormonal changes, things that cause the body to be out of balance, you will potentially feel piriformis syndrome, which no matter if the sciatic nerve is running behind or through the piriformis muscle is going to be tense, it's going to be tight, maybe inflamed, and it's going to entrap or compress that nerve. So that is where you start to feel the numbing, tingling, burning, itching sensation down the side of your leg that goes to about your knee. That's where you feel a numb foot. That's where you feel pain with squatting, pain with sitting or standing or walking for extended periods of time, one-sided SI joint pain. So these are just a few of the symptoms that piriformis syndrome can present, and many times they're very similar to sciatic symptoms. So it's easy to misdiagnose. What we want to do is a couple of things. So if your provider has kind of told you that there's not a lot that you can do about it, what I would suggest is reaching out to another prenatal provider, like a physical therapist that specializes in pelvic health or prenatal or postpartum care, and or a Webster certified chiropractor who specializes in pregnant and postpartum bodies. They will be able to do an assessment on your body and hopefully determine whether it is sciatica or piriformis syndrome. Piriformis syndrome is a little easier to treat. We work on releasing inflammation, trauma, tension in the piriformis muscle, so it takes some of the pressure off of the sciatic nerve and hopefully gets you feeling better. Now, many people that come to my page tell me I do not have access to these types of providers, either financially or just in distance to their homes where they live. So I highly recommend seeing one of these prenatal providers. If you're just not able to, you can try some of these techniques or practices that we're going to do today once you've been cleared for gentle movement practices by your prenatal healthcare provider. So your OBGYN or your midwife, if they've given you the go-ahead to move, then you can do these practices. And if you have any questions, please run it by them before you do them. These are all gentle, supportive practices, and I will give some contraindications or reasons why maybe you should not do them. So we are going to start today with some stretching techniques. So everybody can sit in a chair, right? So we're going to start with a chair, and in our chair, we're going to find our figure 4 stretch. So working on getting your foot to cross over your body. If you need a little help, you can have a partner help pick your leg up and place it on your body. So if you notice that you're having a hard time getting your leg down, there may be some tension, tightness in those glutes and or piriformis muscle. So we want to work on just kind of gently opening that side of the body. So we're not going to push hard. We're just going to gently kind of allow the weight of our hands to press and open. You can relax this foot. And if you are a person who finds this to be an easy movement, an easy posture, you can take it up a notch by finding a forward fold and putting your weight onto the leg so it deepens the stretch for you. Okay, now you want to do this for about 30 seconds to a minute on each side of the body. We want to create balance in the body. So don't just focus on the side that hurts, do both sides. All right? Okay, so then we're going to gently uncross and bring the knee right in front of our body. So we're either interlacing or just stacking the hands on top of the knee. And if that's hard to do, you can bring a hand towel right under your leg and hold it like this. We're going to do nerve glides. And nerve glides, you're going to open your legs just a little because we have our baby in our belly there. And we're going to work on bringing our knee as close to our shoulder as we can. Everybody has different flexibility, so just come to your end range. And then we're going to glide that leg back out. Remember, if you need a towel, you can use a towel to draw knee back in toward shoulder and then back out. So just this gentle movement of in and out. And I suggest doing it anywhere from like 10 to 15 times on each side. These are nerve glides. This will hopefully help your sciatic nerve find some movement away from the compression of the piriformis muscle, or some movement in that space. Okay, very nice. So we're going to release that leg and we're going to do a standing side stretch. Now, for this, we want to hold on to something that is going to keep us balanced. So it can either be the wall or your chair or both. And we're going to cross one leg over the other. So I've crossed my left leg over my right. I'm going to jut my right hip out and I'm going to side bend over to my left side. And that's going to get a little bit deeper into the piriformis, the hip and the glute, some of those hip flexion muscles in the glute. And then release. And you can do it just like a few times for 10 seconds a time, or you can hold for 30 seconds if it feels accessible to do that. Very nice. And then remember, do both sides. So next we're going to come to a seated, and if it's difficult for you to get up and down on the floor, bring a cushion, like a couch cushion. I have a yoga bolster that I'm going to use down onto the ground. So it makes it a little easier. You've got your chair to help lower you down, or a partner to help lower you down. And we're going to take our legs out so they're a good foot and a half away from our body. Our hands are going to come onto our cushion or bolster. I'm going to slide this back just a little so you can see me a little bit better. All right, and we're going to allow both knees to fall over to one side and then both knees fall over to the other side, and work on just finding kind of a tick-tock motion from side to side. Very nice. Good. So those are some movements that you can do throughout your day. I suggest doing them multiple times a day, anytime after you've been sitting, standing, or walking for longer periods. And if you're noticing that your pain or discomfort is getting better with this movement, that is an indication that it could be piriformis syndrome. So if you're seeing improvement, keep doing it. If this is causing you pain or discomfort, more pain or discomfort, discontinue doing it. All right, so that second thing we're gonna do is grab a foam roller. Now you can pick these up anywhere, any of the big box stores, on Amazon, and I will be linking some of my favorite foam rolling and myofascial release products on my Amazon storefront, and I will put the link in the description of this class. If not today, later today. But foam rolling is going to help release tension, knots, tight tissue of your fascia, of your muscles, in your glutes, in this whole bottom area. So some contraindications to this practice would include: do not foam roll over areas if you've had a hip replacement. Do not foam roll if you have varicose veins, over varicose veins. Do not foam roll over broken tissue. So if you have a wound, fresh bruising, open cuts or scratches, don't foam roll over that. And what you're going to do is foam roll kind of your whole bottom. So you can kind of lean into one buttock, one glute, and work on rolling from the top to the bottom. You can use your chair if you cannot come all the way down to the ground. You can have somebody as a support person kind of helping you up. And you're gonna do both sides and really come forward. So you're on the bottom part of that attachment where it meets the hamstring, and do the forward, do the center, get into the side. You can also foam roll the sides of your legs, so kind of your IT band area. I'm gonna scooch all this over a little bit and work on foam rolling through the side. Now this is a little harder, a little more challenging, especially when you're pregnant and you have the weight of your baby in your belly. So try it out, and if it just doesn't feel accessible, don't force it. You can sit on it and roll those muscles instead. All right, so the third thing that I talk about is figuring out what it is that has caused this trauma, that has caused this tension or inflammation in your glutes or your piriformis muscle. And if it's something as simple as working on postural techniques, we work on how we sit, we work on how we sleep, how we're standing, and working on finding a better pelvic posture so other muscles of the body aren't kind of taking over and doing the work that our glutes and our pelvic support muscles are supposed to be doing. So overuse of certain muscles can cause pain and tension in other areas. So we want to find really good pelvic, really good neutral pelvis, so pelvic position. So one way we can do that is with a yoga block, and I don't see one, but I do have a ball. Anything that you can put in between your thighs to kind of give you some guidance of how your pelvis is tipping. We want to make sure that our pelvis isn't, when we have our pelvic structure, that we're not rocking too far forward or too far back. So that posterior pelvic tilt or that anterior pelvic tilt, but we have a pretty neutral spinal pelvic girdle. So you can do this by, I'm gonna set this ball down for a second, by kind of just rocking your pelvis, tucking tailbone under, then rocking it forward, playing with the curve, and then we wanna take something in between our legs and squeeze it. And as we do that, our pelvis will go into a nice kind of neutral pattern. So we wanna work on pelvic posture when we're standing, so we're mindful of how we're standing, so we're not putting our body in a posture that's going to cause misuse of other muscles, that can cause tension in our piriformis, that can then squeeze or compress that sciatic nerve. When we're sitting, we want to do the same thing, just kind of rock the pelvis forward and back until you find a nice seat so that you are on your sits bones, these little bones right here at the bottom of your pelvis. Those little bones where if you put your hand under your bottom, you can feel that hard bone poking into your hand. We want to be sitting upright on those. And most furniture kind of puts us in this posterior pelvic tilt, which can cause all sorts of issues. So we want to find that we're sitting up nice and tall, and you can do that even with resting your back on the chair, still being mindful that you're sitting on your sits bones. Okay, so those are a few of the practices that I like to suggest for folks who have the symptoms of sciatica or piriformis syndrome. Remember to call a prenatal provider, and if you are interested in having a full class on relief for piriformis syndrome, I am going to be offering a free fitness class to my